practitioner at the Family Practice and Counseling Network in Philadelphia. At Penn, when he was a PhD student, he researched Alzheimer's and family caregivers.
Still doing that. One more year, guys.
He writes regularly about social justice issues in Philadelphia Weekly. He is a co-founder and chairperson of Enabling Minds, a nonprofit that works to educate children with developmental disabilities in Haiti. Tarik.
Thank you. Thank you very much. How y'all doing today? I don't know how I follow the great Brian Sims, but how can we get it for Brian Sims? Brian Sims. So do y'all want to hear a story? Since before the Civil War, just a few blocks north of City Hall, there's been a hospital that was built to serve the city. A hospital that may have served Revolutionary War veterans and those whose infancy matched the infancy of our nation. A hospital that was founded on the revolutionary principles that, with a little bit of love, compassion, and medicine, our bodies can heal themselves. It was a place that would go on to serve millions of Philadelphians. On that hallowed ground, those who toiled day and night, they didn't work to serve the well-to-do, although they served the rich and the poor and everyone in between. Hahnemann has been known to open its arms to serving the entire community and to serve the poorest among us.
Thank you.
Those folks at Hahnemann, they didn't just tolerate those who couldn't afford their care, they welcomed them.
Thank you.
Our most vulnerable knew that my patients know that when other hospitals would reject them, Hahnemann would take them. They would welcome patients with name bands from other hospitals because there they could get care. And who would Hahnemann welcome then? It was their nurses.
Yes!
It was their doctors.
Yes!
It was their workers.
Yes!
So when years went by without any major renovations or improvements, they stayed. When the hospital was passed from one bad owner to another, they stayed. When units were staffed with unsafe nursing levels, they stayed. While others came and left, they stayed.
Wow.
I know these nurses. They'll stay up with you when you're sick. They'll spend holidays sitting on patients' bed. They'll come, after they've clocked out, they'll go back to the patient's room and they'll sit with them. And they'll fight with anyone who tells them to give up when you know it's not over. I know these nurses, and you know these nurses. And these nurses deserve better. Our patients deserve better. They deserve better than a guy like Joel Friedman, the investment banker who sold them out. Joel Friedman, he came in 18 months ago promising to pour money into the hospital, swearing that he would help them. We recently learned that Joel Friedman, that's right, we recently learned that Joel Friedman's company, quote, settled with the Justice Department for violations of the False Claims Act back in California. For violations of the Physician's Self-Referral Act. And for violations of the anti-kickback law. Yeah, they bribe medical directors to make referrals, and then they submitted false claims to Medicare and Medicaid. Joel Friedman. They also refer patients for not what was best for them, but for other hospitals owned by Joel Friedman. For those illegal kickbacks, the Justice Department just settled for $8.1 million. Okay, and that happened earlier this year. Do you know what else? Which other hospitals owned by Joel Friedman suddenly announced financial problems that were unsustainable earlier this year? That's right. What hospital was that? It was Hahnemann, right? When he bought Hahnemann, I heard that they separated the hospital from the land that it was under. So if they declared bankruptcy, the land and the physical assets would separate. What did Joel Friedman, what do they like about that land? Do you think he liked that Hahnemann has over 1.5 million square feet of hospital space?
No.
Do you think that he liked that it had unparalleled access to the Broad Street subway, the L, the trolleys, the regional rail?
Yes.
Do you guys think he liked the driveway access from I-76 and 95? And now they're talking about putting office spaces up there. They're talking about putting hotels on that spot. They're talking about building condos on that spot. Someone heard that Joel Freeman expects to make $400 million from that property. If that goes through, this is going to be a test case, guys. This is going to be a test case for private equity firms closing safety net hospitals around the country. But like he did in California hospital with his illegal kickbacks, it looks like Joel Freeman is trying to skirt the law again and close the hospital before he's legally allowed to. Hahnemann is now down to 10 patients. It's supposed to close in September. So I have a revolutionary premise. How about we don't let the profit corporation poach our land for condos? This stops here. We stop this now. Are we going to let them poach our land for its real estate?
No!
Are we going to let Joel Freeman pull a Mitt Romney and pillage our hospital for its assets?
No!
Are we going to let Joel Freeman pull a Donald Trump and shaft his workers?
No!
Or are we going to stand with the nurses?
That's right!
Yeah, are we going to stand with the unions?
That's right!
Are we going to stand with the 2,500 employees about to lose their jobs?
Yes!
Are we going to fight so nurses won't lose their pension and their benefits?
Yes!
Are we going to fight for the residents and the fellows that are going to lose their funding as a result and who may be deported by Donald Trump because of it?
Yes!
Something must be done. I've already heard that crowded ERs in the city are backing up. They're flooding with hundreds of extra patients that Hahnemann saw in their ER each day. Patients are no longer getting seen. The critical services like mental health, labor and delivery are no longer being offered in that neighborhood. This is a place where I send a lot of my patients, and a lot of you go there as well. And let's remember who's going to be affected the most. Most of Hahnemann's patients are people of color, and they're also people who happen to be poor. So what can we do? We can show up tomorrow. There's a rally at Hahnemann at 5 p.m. to save that hospital. Are you guys going to be there?
Yes!
Tomorrow at 5 p.m. Are you guys going to call the mayor?
Yes!
Are you guys going to call the governor?
Yes!
Are you guys going to call city council?
Yes!
Are you going to remind them that this fight is not over?
That's right!
Are you going to let them know that we haven't forgotten about Hahnemann?
That's right!
Is our demand to save that hospital and the workers who work there?
Yes!
Don't let Joel Freeman and his corporators win. This is our hospital.
Right.
This is our city.
Yes!
And we are not backing down.
That's right!
Thank you.
Thank you!